Hi, I'm Dr. Jim Fox.
And I'm Dr. Janine Fox.
And we're here from Doctor's Nutrition. Thank you for joining us today. I think we got something that's going to be very interesting for you, especially if you have something called Meniere's. It seems there was a recently published article about using a compound called it's actually a mushroom called Coriolus versicolor. Some people call it the turkey tail mushroom. And it's confirmed as a potential new treatment for the Meniere's disease.
Right. And if you're wondering, okay, what is Meniere's? If you're searching Meniere's, you probably already know what it is because
That's
people
right.
that have it know what it is. But it is an ear problem, and it actually is like an autoimmune ear problem.
Right.
And people get a real sense of fullness. They get dizziness. They get vertigo. They get tinnitus. It becomes very debilitating. So it is something that people that have Meniere's, it is horrible, and there's not very good medical treatment for it.
No, that's
why when we saw this article, we were like, we need to let people know about this, because if you're out there searching and you have Meniere's, you're going to want to listen to this because it definitely could help with your symptoms.
Yeah.
It was published just recently in Current Neuropharmacology. And in the study, they actually used, like he said, the Coriolus versicolor, which is turkey tail mushroom. Mm-hmm. We've used that for years for other conditions. But I can honestly say we haven't used it for Meniere's because this was a new thing for us as well.
I guess that's something that we just never thought about, so to speak.
We used it. There has so much. It's the most researched nutrient for cancer that is out there.
Actually, the Japanese kind of pioneered this thing, and we've been using it for 20-some years, I would say, roughly. With various people and various kinds of cancer, people that are doing conventional treatment and just want this as supportive care.
Right. We also use it in people that are doing chemo to keep their immune system from falling.
Right.
And there's been a lot of research that shows that it helps chemo work better. So anyway, back to the study on Meniere's.
Right.
On this study, they had 50 people, and 30 people took the mushroom and 20 people did not. So they had a comparison. They had a group they could compare it to, and they would have them do questionnaires on their symptoms, their problems, what they saw is better. But they also did lots of lab work that actually did markers, where it wasn't just somebody's opinion on whether they were better or not. It actually looked at markers in the blood to see what was better. Now, the dosage that was used was 1,500 milligrams twice daily.
Right.
So it's a pretty good dose, but that's what we've used kind of for years. So it's not an abnormal dose. We've always used it on an empty stomach. It didn't say that on this study, but on what we've seen, we've always used it on an empty stomach.
I think that goes back to some of the early Japanese
some
data.
of the studies that shows that it was best absorbed that way. Mm-hmm. So you take it first thing in the morning, and then again, usually right before you go to bed, because you should have an empty stomach. And what they showed, one of the first things they showed was at 3 months, and they looked at 3 months, and then they looked at 6 months on this study. They showed a significant higher level of markers that show cellular stress. They showed that they were better in the mushroom group, but not in the people not taking the mushroom.
Yeah, some of the markers that they watched was the NRF2 and then the SIRT2 and the SIRT1. I mean, if you looked into anti-aging, anti-aging medicine, anti-aging phenomenon, so to speak, SIRT1 comes up all the time.
It does.
You can thank David Sinclair for that one because he brought that out into the mainstream. It's used and that was one thing that they showed that this Coriolus versicolor actually increased the levels of the SIRT2.
Right. And then what they showed was these markers also continued to get better and better as they went on through the months. So, they stopped at 6 months. But from 3 months, they showed a really good, benefit. And then at 6 months, it was even better. Now, another thing that was tested was glutathione. And glutathione is another thing we've all used for years in natural medicine and anti-aging and detoxification and everything else. Glutathione is one of your own body's markers to help with oxidative stress. So when you look at the oxidative stress, they showed that the group that was in the mushroom group, levels were increasing to where the people that did not take it, they did not. So increasing glutathione levels with the Coriolus versicolor was another thing that was shown.
Yeah, and I think now there was a little tidbit that came out of this about one of the other inflammatory markers that they watched. It's stuff called alpha-synuclein. And what it is, it's actually associated with Parkinson's and the Lewy body.
And Lewy body dementia.
And and if you've never known anybody that's went through Lewy body dementia and or Parkinson's, dealing with Parkinson's right now, And this just kind of blew us away when we read it. I mean,
Yeah.
seriously, because we've looked at it for cancer and so
Right.
on in the past, but looking at it for neurological stuff, wow! And especially when you start talking about something, because dementia is on the rise. I promise you don't talk to anybody with every day that we're in the office. I promise you, there's at least a half a dozen people telling us about either something that they've noticed in themselves, a parent or a cousin, an uncle, somebody in their family is starting to deal with various forms of dementia. And so it's kind of a scary situation.
Right.
out
So
there
when we
now.
saw that, yes, they were looking at Meniere's patients and showing that it actually decreased the expression. But if it can do that in that protein, it can also do it, I would think, in people with Lewy body dementia and Parkinson's.
Yeah.
So, they've also showed decrease on inflammation markers.
Right.
So it's like every marker that they looked at when people were taking the Coriolus versicolor, it was better when compared to the control group, which
Right.
was the group that didn't take the mushrooms. So that's kind of extraordinary. And if you're one with Meniere's, you know how hard it is to have things to help it. And so we definitely wanted to do a little show. There might not be that many people out there looking for it, but we've seen an increased rise in Meniere's. So we know people out there are looking for solutions.
Yeah.
And when they did at the end of the study, 6 months, they did a questionnaire. Okay, so all this was before we were looking at all the blood work, and all of it improved. All
Right,
of it improved with the
everything.
mushroom group. But they also asked the people, how are your symptoms? How is the vertigo? How is the tinnitus? And actually the frequency of all the symptoms was way down in the mushroom group. So
And that's significant.
actually, if it was me and I had Meniere's, I'd be trying Coriolus versicolor because it really does look like it could be part of an answer. We've always used the bioflavonoids, and even we have a bioflavonoid complex with quercetin that does help some. But Meniere's has always been very hard to treat. So when we've actually saw this, we're real excited about trying it in people. So it just came out this week that we saw.
Yeah.
So we're going to start trying it in people, and we will keep you updated on how it's working with our patients.
Yeah. So hopefully you got something out of this little tidbit of information here. And be sure and hit that subscribe button and that little bell for future notification. Thank you again for joining us so you can live healthy
And be healthy.
I'm Dr. Fox, and I want to thank you for watching this YouTube video. Be sure and hit that subscribe button, hit that little bell so you'll be notified on any upcoming videos that we have coming up. And thank you again for watching our YouTube videos.